We all know the importance of exercise, and this is especially true if you've had breast cancer treatment. Why? Well, we know that studies have shown that exercise following breast cancer treatment reduces the risk of recurrence and also improves survival. The thing is, it can be a little bit overwhelming. When can you start exercising following treatment? How much exercise can you do? Should you be exercising through chemotherapy? Will exercise affect the surgical site? There's so many questions and there is so much noise out there. So today, we're going to be talking about it.
Hello.
Hey, how are you?
Right, I am a cancer referral specialist, if you like, here at Romford YMCA, level 4, Wright Foundation qualified. And our primary task is to get people through their cancer journey, whether it's at the beginning of the cancer journey, where they've just been diagnosed, or indeed as they're going through treatment, or their onward journey after the treatment strategy, so that we can avoid, particularly with us, to avoid a secondary cancer. That's the main thing.
That's the main thing. When should people start exercise during their breast cancer treatment? Should they start it straight away? Should they wait? What would you say to that?
The answer to that is very bespoke because every individual presents differently,
Right.
as you would know.
Yeah.
In simplified terms, straight away, whatever is appropriate. The thing about this program is very bespoke.
Right.
So everyone presents differently. Everyone has different scenarios. They might even have the same cancer, but they all have potential of being able to do a lot. Others can't do much. So absolutely do what you can, and that's where we come in, because there are other individuals who might be able to do a hell of a lot, and others have to really sort of tiptoe around. But the bottom line is, whenever you feel you can do something, even when you're going for chemotherapy, absolutely try and do something. We know now, it's proven that to do something is better than not to do anything.
Absolutely.
On many counts.
That's really good. So essentially, you need to get the okay from, I guess, your surgeon if you've
absolutely.
post-surgery.
Exactly. I mean, clearly we need clearance from the oncology department to make sure that it is appropriate for that individual to be able to partake in an exercise program. And once we have that clearance and we know that individual can do appropriate exercise, then we have the green light to proceed with that person.
Great.
In an appropriate manner.
In an appropriate manner. And it's important to do exercise for a number of reasons. As you mentioned, we know, studies have shown that it reduces the risk of recurrence, it improves outcome following breast cancer treatment. And the thing is, many people may be slightly overwhelmed with, what to do, where to look, how much exercise one needs to do. From your perspective, you say that it's individualized and it's personalized according to that person's, fitness level and exercise tolerance, I guess, and their cancer as well, and what treatment they've had.
Yeah.
How do patients generally adapt to the programs that you give?
Well, our program is a 10 free sessions. They don't have
Right.
to be running back to back, obviously, because there's certain treatment strategies that creep into the program. But one thing I need to make clear as well is that the whole idea of this program is not to make you feel that it is a gym-based exercise program. You don't have to stay to the gym afterwards.
Right.
The primary thing is to get people moving, grooving, if you like. Just increase your ADLs, ID, activities of daily living, rather than have a sedentary lifestyle, which is detrimental to cancer and the premise of it coming back. So be a little bit more active. Absolutely change your dietary strategy if you can. Not to be completely regimented, but we know, without getting too technical, that carcinogens are very detrimental to the cancer process and igniting it up again. So tweaks, what we do is give some tweaks, some dietary advice moving forward, and to get people with a gym-based environment here. And if they don't want to embrace that fully, just embrace the aspect of moving around a little bit more when they finish the program here, or indeed stay with us.
Yeah, brilliant. So you get referrals from certain hospitals for those who've had breast cancer, and they follow a 10-week program, and you basically personalise their treatment plan or exercise plan according to their limitations, and then you follow them through the 10 weeks, and after that,
That's correct.
they can continue
Yes.
on their own. So the other question I get asked quite a bit is about things like lymphedema. Understandably, many following breast cancer treatment are either worried about lymphedema or have lymphedema and don't know what to do about lymphedema. What would you say to that?
Well, the interesting thing about lymphedema, obviously some ladies come with us with a sleeve on and to reduce the swelling aspect. But the main thing we do realise now with lymphedema is move around as much as you can to get the lymphatic system moving again. So we give them appropriate exercise that may involve just moving the arm up, crawling up a wall, up and down, things like that. There's about 7 or 8 really simple exercises that we recommend that individual, and it is as simple as literally putting your hand on a wall and walking up and down, or just being on a table and moving your arm forward, backwards. But the essential nutshell bullet point here is to try and move as much as you can with that arm.
Okay. And how about weights?
Weights, appropriate weights, absolutely. We tend to find that, just the 1.5s and 2.5s that we got here, up to that sort of weight, to do simple moves. If they are able to do a what we call a lateral raise or a shoulder press. But we tend to start off with just empty hand, walking up walls, things like that. Just gentle little arm swings.
Okay.
When we feel they've moved on after a couple of weeks with that, then we can give them hand weights. But again, the thing to take home from this is to be able to move around with your arm. Move around as much as you can. Because that will help with the drainage. That will help with the movement of the lymph nodes through the body. The lymphatic system will start flowing. It's like a stream. If it's flowing very slowly, everything's just going to go through. Once we get it moving a lot, all the debris goes through a lot more quickly.
Okay, no, that makes sense. So I guess the take-home message for lymphedema: move around, and once you've got good movement, then lifting weight is actually not a bad thing. So I think many people avoid lifting weight with lymphedema. Actually, that's not.
When it's the appropriate time to do it. But certainly, and you should be given some exercise from the physio. With regard to lymphedema. And crack on with those, because we've all got to help ourselves as well. And trust me, if you embrace these exercises, you'll get your full arm movement back. I've dealt with many ladies that. I had a photographer lady who you could even lift her camera up. By the end of the 10 weeks, she was no problem. We've got her moving.
That's amazing.
And that was purely with an exercise strategy. So
I mean, I think this is just a flavour of what you can do with exercise.
100%.
The moving forward course is what you're part of. It's a 10-week course, and 10 weeks actually, in the grand scheme of things, it's not that long, but. The benefits of those who've gone through a 10-week program is pretty immense. And I've met quite a few of them today, and they say that an exercise program, a consistent exercise program, is extremely beneficial. So, do you have any kind of last words to those who have had breast cancer going through treatment or post-treatment? What would you say regarding exercise?
Well, I would say to any of those individuals, don't give up on this, because the success rate we've had with people who partake in a healthier lifestyle, i.e. dietary and particularly exercise as well, put the two together and you will definitely come through the other side. You absolutely will. There's so many positives, and we've spoken about the physical aspects, but another very, very important part is the psychological aspect. Because once you start moving around, you start to feel better, and psychologically you have that support system from your personal trainer, if you like, other people in the gym, your family, and you've probably noticed that today, Tash, that the ladies, when I start with these ladies at the first couple of weeks of their program, naturally they're very anxious. You get these huge, long, complicated diagnosis forms, and it's quite concerning. But once we break it down and tell them, in layman's terms, what's going on here, how we can beat this, and we can, with appropriate exercise and diet, all of a sudden, by about week 3, 4, 5 in particular, their psychological benefit is kicking in. They're really feeling positive about themselves. Yeah, I can beat this. And by the end of the program, as you've witnessed today, these are different ladies. I've beaten this thing. I'm going to beat.
No, absolutely.
That's why I believe in this passionately. And I can't recommend enough for you, any of you ladies out there that you are unfortunately diagnosed with this, please embrace the positives of what this can do for you. You will come through the other side. But if you make changes to your lifestyle and move around a bit more, I promise you, secondary cancer can be avoided or certainly beaten a lot more easily.
My name's Marcel Williams, and I first came to the YMCA because I was looking for some exercise post-surgery, and I'd been to my GP and there were no referrals for anyone who's had any type of cancer, only for stroke and obesity and diabetes, but no referrals that I was able to get. So somebody said that they just set up a scheme here at the YMCA, which is sponsored by our local council, which we had only just started. And then I referred here, and I spoke to the people here who joined me to the scheme, which was free at the time.
Right.
But unfortunately, the Havering Council, after a year, stopped sponsoring it. So, being a charity, I got very passionate about the fact that we were going to lose our funding here and wanted to help and do something about it.
Oh, great. That's very kind of you to kind of be so actively involved here. So, tell me, you had a breast cancer diagnosis, is that?
I did. I didn't know I had breast cancer because it was there was no lumps, it was just diagnosed through having a screen.
Yep.
Which ironically got cancelled for 2 months because the machine had broken, the mammogram machine had broken. And when I went back, I was called back, and then the process started from there. But there was no signs or symptoms at all.
Right. So it picks up on your screening mammogram.
On the mammogram,
right.
Yes.
Okay. So today is all about kind of exercise, and you joined the program 9-10 years ago.
Yes.
And you went through the program, yes, exercise program.
Yes, I did.
How did you benefit from it?
Amazingly. I'm so passionate about it because not only did it help me mentally, it helped me physically as well. I had always done a lot of running since my early 30s, but that's all I did. And then when I came here, I was introduced to a various amount of different types of exercise. I had no minimum movement. I had a muscle taken out of my back.
So you had LD reconstruction?
I did have an LD reconstruction, and I had very weak right arm after that. I couldn't raise it up fully. There was a lot that I couldn't do with it. So Vicky, who was leading the scheme at the time, introduced me to a real selection of exercises to build me up, to give me some strength back in that arm.
Wow. So you followed it through and you gained immense benefit from it?
I did, absolutely. And not just that, she was there at the time to talk to me, have a cup of tea, also to help me with the mental process, which I strongly believe you need as much as the physical exercise.
Yeah, I think you're absolutely right. And it's something that we probably don't talk enough about because the physical effect of surgery is very obvious.
It is, yes.
But not necessarily the mental challenges that you might face. So I think you feel that doing kind of a community-based exercise program, which
yes.
This is an example of, not only do you get the benefit from the exercise, but you also get the benefit from the community side. Is that right?
You do. And also I made some lifelong friends through this scheme that we've all got the same thing in common. We wanted to exercise together, but we also sometimes wanted to chat and talk about the fact that we had breast cancer. And I think it was just so invaluable to have this program here, to be able to do that, because I don't think you can talk to your family. You don't want to upset them, and they are going to feel sorry for you, irrespective of how much you don't want them to. They're going to have that sympathy, whereas people who've been through the same scheme are not going to have that sympathy. They're just going to share your journey with you.
No, that is so true. So what would you say to anybody who is thinking about exercise, who are not sure about taking up exercise? What would you say?
I would say that there is so much variety in exercise. For example, I broke my foot quite badly last year in 3 places and detached a ligament. And I was hopping on crutches for 10 weeks.
Right.
3 days after I did it, I actually got in my automatic car and drove here and introduced myself to exercises that I could do sitting down.
Absolutely.
You do not have to stand up. You don't have to run. You don't have to get your heart rate up. considerably. There is, especially our YMCA here, there is such a variety of machines and weights and things that you can do in a seated position, even if you're in a chair.
Absolutely, yeah. So there's really kind of no... I think people, when they think about exercise, it's like, okay, exercise equates to the gym.
Yes.
Or exercise equates to having to exercise for, an hour, 45 minutes. But actually, that's not the case, is it?
No. I work in a hospital myself in the physio department. People that can't get out of bed, I will give them water bottles just to do some exercises in bed to keep moving in bed, because otherwise muscles are memory, and if you don't use them, you lose the key. Exactly.
Yeah. No. Well, I think, for anybody who has any doubt about the benefits of exercise, I hope, Marcel's story and what she's described will dissuade you from not doing any exercise. And you don't have to do, anything super, super strenuous or, active. Walking, movement, something is better than nothing.
Absolutely. And at the YMCA, we have specially trained cancer people who actually, have been through the course, so that they had that sympathy and they had that knowledge of people who've had the ability to take each individual person at their own pace as well. Also at the hospital next to this YMCA, we have a prehabilitation for referral scheme. So we've sent people over here who are about to start their cancer journey, really and to get them fit before and through their cancer treatment, as well as after as well.
Yeah. And that's really a good point, actually, Marcel, because I think if you are going to undertake any form of consistent exercise, it would be a good idea to go and have somebody who's had the cancer trainer, the cancer certified cancer trainer, because they will be in a better position to be able to help you. Well, thank you so much, Marcel. You're so well for sharing your story. Really appreciate it.
Thank you very much.
Thanks.
Thank you.